2 o'clock on Friday afternoon, and we're back with another local business in our community. It's you can see on the screen here, I got Jeff Lichtenstein, owner at Echo Properties. Jeff, give a wave. And then to the left of me is Dr. Chrisitian Carlstrom, owner of Spine Design in Jupiter off of Indiantown Road. Say, hey, Christian, how are you?
Hello, doing great.
So there's a picture behind me too. Is that you working on somebody's back right there?
That is me right there. Yes, you got it. I look a little younger in that picture, but yeah, that's me.
Christian is by far, has the best hands of any chiropractor. I think so much of it is, it's based on feel, and he's got really good feel, just knows immediately where, feel what's going on and diagnose and correct, really quickly.
Well, before we got started here, Seth, I said to Dr. Christian, I says, one of the things I've been doing all these Zoom business interviews with these local businesses, and I swear I sit down at the kitchen table and I am there for I think it feels like hours straight. So my back, it's got like a tightness in the bottom of the back. So I'm going to ask him later after you interview him about some tips on how to get rid of that stiffness in my back. But I'm going to let you take it away, Jeff.
Okay. So, hey, Doc, good to see you.
Good to see you too.
Yeah. So, tell us a little bit about your practice. It's more than just, chiropractic. You do a lot of different things. And, when I went to see you, must have been 7, 8 years ago or whatever. I was really impressed with how much time you took at the beginning for diagnosis and going to the back and really analyzing anything before you did anything. So, tell us a little bit about the practice and your background.
Sure. We opened up our business back in 1999 in Jupiter off of Indiantown Road. We used to be in Seagrape Square. And after about 8 years, we moved into our location behind, which is now Water's Edge Dermatology, next to Jupiter Fitness Center on Indiantown Road. And it's we've been there for about 12 years. So a total of 20 years in Jupiter. It's been a blessing. It's been great. And my wife is also a chiropractor, Denise. So we've had a successful chiropractic practice for 20 years. And recently we also added physical therapy with a doctor of physical therapy, Dr. Caitlin. We also have massage therapy, 2 massage therapists in our office that also helps out to not only make people feel better, but function better and stretch people out. And we also do weight loss, which my wife is in charge of. So we're doing Ideal Protein, which is a quick and efficient way to make people lose weight. And then we also have a red light therapy, which is also a way to melt the fat away safely and effectively, and also to contour and produce healing into the body, called lipomelt. And the final thing that I also do is a lot of scoliosis care in the area with a dynamic brace called Spine Core, which I've been doing for about 12 or 13 years now, which is a much better way to use than a hard brace. So we've been doing a lot of scoliosis care as well. So
I know you're not a Florida native. Where are you from originally?
Oh, yeah, I'm originally from Sweden. I'm a dual citizen, American and Swedish. I came over when I was 18 years old, born in Stockholm. And I came over, played professional tennis for a year. And then after that, started college and played tennis at UCF for 2 years there and 2 years in undergrad at Indian River Community College back then. So I played 4 years of tennis, and then I moved up to Atlanta, went to Atlanta for 4 years for chiropractic school, and played ice hockey for the school up there. So, yeah.
When did you decide to get into to be a doctor? Where did that come from?
Good question. When I was my first year at the university here at the Indian River, I had a knee issue and a lower back issue when I was basically 19. And I went the typical medical route to the orthopedic doctor. They sent me there. They gave me anti-inflammatory pills and then rest and ice and the basic therapy, and it didn't give me the relief that I needed. So I ended up going to a chiropractor my first year in college. And 3 weeks after I saw him, I felt incredible. I was back to playing tennis, and he really turned me on to chiropractic, and I felt like that's what I wanted to do.
For people who've never used chiropractic, or some people get nervous with it, and I find you to use a little bit of both. You've told me, hey, go get an x-ray in here and you may need orthopedic or something, but tell me a little bit about explain to people what it is.
Okay, so the first thing we do when somebody calls in and asks for an appointment is to obviously get their basic information, and really from the beginning they step into our office, we really want to educate them on what chiropractic is. So we typically have them watch a little quick video. We explain what we're looking for today, and we take them back and do a full exam, chiropractic neurological exam, where we look at their posture, range of motion, palpate their spine, reflexes, and then also the most important thing is we take x-rays of pretty much everyone that's a patient in our office, so we can make sure that there's nothing that's way abnormal or something that might need more emergency care or something from a surgeon, for example. So we take every precaution we can to make sure that they feel safe and they know what it is, and we explain exactly what it is that we're going to do before we start treating them, so that people feel comfortable.
What is the main benefit that chiropractic provides?
The main benefit of chiropractic is that, the premise of chiropractic is basically, the brain and the nervous system controls everything inside your body, from breathing to healing to hormonal production, to contracting a muscle. Every thought, everything's got to go through your brain and your nervous system. And obviously the extension of your brain is your spinal cord, which is then protected by your spine. So when your spine misaligns, if you have a shift of your vertebrae, then it can put pressure on the nervous system, and it can either create pain, dysfunction, or lack of movement. So our job is to find those misalignments, which are called subluxations. And then we realign the spine to take pressure off the nervous system, let your body heal from the inside out. So that's really the premise of chiropractic.
And it's a lot, from what I understand, it's always been a lot. It's like blood not flowing
That's right.
Directly to where it needs to go to heal the body.
Yes. So our goal is to actually improve the nerve flow, which again controls the blood flow. So if we can improve the structure and the function of the spine to affect the nervous system, not only are you going to feel better and have better range of motion, less pain, but you're also going to have a stronger immune system, better function, and better healing potential. So that's really the goal of chiropractic.
When you're there's lots of different things you do. A lot of it is stretches and exercises and movements, and when you're doing the adjustment itself, so much of what you do is on feel. Is that a natural thing that you have?
Well, I think it's both. I think some people just have a natural feel for the body and to sense and feel things. But it's also something that you train and you get better at. So in chiropractic school, you just basically start practicing on a doll almost, so to speak. And then you move into practicing on each other, like in student clinic. And then when we're getting somewhat efficient at adjusting and safely under supervision, then you get outpatients and you start training or getting better with real patients. And then of course, years of chiropractic, you get better every day. You touch somebody, you get a better feel for it. So it's a little bit about some natural ability, and it also helps to be an athlete. I think athletes make better doctors in a way, because you can actually, you have to actually physically touch somebody. You can't just be book smart. You got to be able to have both.
You also feel when you're an athlete, maybe you feel more hurt spots as well. So you kind of know you have to know your body better in that way.
Yes, I think so. I think it makes sense, because you're actually thrusting into the spine. We also use our hands, but also instruments and the table. But when you physically touch a human body, you get better at it. You're feeling for restrictions and tender spots and muscle nodules and everything else. Yeah.
And then explain how there's, when you have a injury or something needs to move, it doesn't you can't just have one movement and it sits still. It takes a time.
That's right. Yeah, a lot of people obviously want that one-time miraculous adjustment where we treat you once and they think it's going to solve 40 years of degeneration and damage. But many times, obviously, it's a trained pattern. Most people, they do the same routine every single day. They sit the same way. They drive the car the same way. They sleep the same way. They brush their teeth the same way. So we develop these abnormal patterns of the spine that it takes time for the brain to accept these new positions. So it's just like learning a new golf swing. You don't just practice it once and you think you're going to be Tiger Woods. You gotta do repetitious. You got to do multiple times to really get the bodies to start accepting this new pattern and new position of the spine. So it takes time. So we do that traction exercise and adjustments to really make the spine be able to be stable and find a new position. So,
hey, Rob, can we show the photo that you're in for a minute? So this is when somebody first comes in, you're doing a lot of, show what's going on in that photo.
So one of our biggest things that we do in our office is we look at people's posture. So posture is a trained or a learned behavior that if you don't change the structure of the spine, your posture will never get better. So what we do initially is we look at if one's shoulder is higher, is the head tilted, is the head turned, is one hip higher than the other one? And then, we put that down into the notes. And then our goal is going to be to mirror image that so we can truly change the posture more towards normal over a series of treatments and adjustments. And over time, hopefully, we'll get them to be at a more stable structure and more straight and level. So that's what we're doing there in that position right there. It's just look at the posture.
And, for me, my posture, I lean one way over the other. And just by talking to you, you start to become more aware, of it. But there's that whole diagnosis where you're looking at x-rays and you're doing it. And so what percentage of your clients that come in, you end up adjusting versus stretching and or other exercises or other things that you're doing?
Well, I would say that pretty much everybody needs to get adjusted. Whether it's for improving their posture or the spine is just locking up, because everybody has a sedentary lifestyle. Even young students, they sit around today so much on their phones and video games and everything else. And of course, everything nowadays, even more so when we're doing everything over the internet, with a Zoom video. So we find that most people need definitely to get adjusted, whether it's to bring motion in there or to realign the spine. And stretching and traction, we pretty much do with probably 70 to 80% of our patients. And then we also do probably 70 to 80% also do postural exercises. So we strengthen their spine in a better posture to actually hold the spine where it belongs. So we do exercises, traction, and adjustment for most of our patients, unless they're really, really young, like little babies or something. And of course, it's just light adjustments.
So we're talking about babies. Is it okay is there benefits for a baby to get adjusted?
Absolutely. It's just like having, when you get your teeth. I mean, we pretty much teach our kids to start taking care of our teeth and brush the teeth as soon as you have them. So you're born with a spine, and a lot of times you can have birth trauma from C-section, vacuum extraction, forceps delivery. So we find a lot of misalignments and tension onto the cervical spine at an early age, which can many times go undetected because it's not something that most pediatricians and OBGYNs really look at. That's not their area of expertise. So we end up sometimes just fine-tuning the baby's spine and then make sure that they grow up with a healthy start, in life.
Well, I think from what you're talking about, just to put it more simplistically, when something does degenerate, you can't bring that degenerative part back. So if they're working at a 65% capacity, all that you can get to is 65%. You're not going to you're never going to get to the 100 because it doesn't exist anymore. So if you're starting at a young age, you're never going to have the degeneration at the same rate as somebody else would be. And you're really more than when people get into their 60s, 70s, and 80s, that's where it gets really bad. Yeah,
that's exactly right. I mean, I wish that you could feel your spine deteriorating or being misaligned right away versus when it's like almost too late sometimes. So it's just like anything else, cancer and heart disease. The best cure for that is to make sure you don't get it in the first place, or try to be proactive and find it early so that you have a better chance of fixing things. It's the same thing with your spine. So yeah, that's exactly right.
Why do you think the public, I think today it's much more accepted than it was 30 years or 40 years ago. Why was there years ago a stigmatism towards chiropractic? And is it the explaining of it? Because it's hard to explain and it's hard to understand the benefits of it.
Well, I think that when chiropractic first came about over 125 years ago, they didn't have the education that the typical doctor had back then. So it was more like a 9-month education, and it wasn't viewed upon as being a real profession. But when people starting realizing that it helped people, and the science came about why it was working, I think nowadays we have 8 years of college just like a regular MD. So I think that made us be more acceptable. And then when insurance companies started accepting chiropractic as a natural form of healthcare, that helped the public to be thinking that it was a real thing. But also back in the 70s, there was also an anti kind of chiropractic medical group that tried to shut us down because they looked at us being a threat or something. and that got shut down, of course. But I think it's just had a little bit of a negative stigma sometimes from other professions. But nowadays, I work with a lot of MDs and all kinds of profession, and we all do different things. And I think it works together. Everybody has their own specialty.
Right. And I think a lot of what you do too is you explain what you're doing, and you're teaching all the time with, even like massage. Like right now, I know, like if I get lower back pain, like what Rob's getting, if I stay in a stationary chair and, and I turn one way to the left and the other way, I'm stretching it out, or I'm doing different exercises. Like I'll lay on my back and put my, and then take my hands and move them over between my knee and on both sides and stretch it that way, both ways. That helps with all sorts of stuff. So there's just different, things that you guys teach constantly. Like through this, it's helped me at least maintain it. It's not as good as going in, but it's been able to help me through here at least. And I'm more aware of my posture and different things I'm doing, I think, by, when you see you as well.
Yeah, I think that's one of the reasons too, why our profession is becoming more accepted, the last 20 or 30 years, is because we are taking the time to educate the public and also our patients about what we do, so that they understand that it's not something weird or voodoo. It's a real thing, So if we can teach our patients about what normal posture is and how to do some self-care at home, then, I'm on their mind a little more often, and they can also correct things before it becomes a big issue.
But, and I can just tell you, Christian's just the most of, the people there are all professional. They know what they're doing. You feel very comfortable, and just has a great feel. He's just got a great brain and feel for it, that combination for diagnosing and then moving it on, and different things that you need to do there. And it's a family atmosphere. I think some of that also, the way you are about it. He's a stitch. But even beforehand, I was like, should I go on? I got to get my hair. I said, Christian, nobody cares about your hair, but I think part of the way how you feel also loosens people up, so that they don't feel, when you're doing adjustments and stuff, nobody's really thinking about any of that.
Yeah, we try to make people feel comfortable, and it's a big family atmosphere. Like I said, we see families, we see grandparents, kids, babies, newborn. I sometimes do house calls after people have had their babies. I go to the house and just check the baby and the mother, and I don't know. It's a small community, everybody knows everybody, so it's a very non-stuffy environment. There's no such thing as Dr. Christian. You can call me whatever you want. I still like you. I don't know. I just love people. I'm a people person, so it's pretty cool.
What are you doing with COVID right now? How has that changed, practice? Somebody comes in, who's, nervous about it. What can they expect coming in?
Well, we've definitely seen a decrease in people coming in. There's a lot of people that have valid reason to stay at home. But the number one thing we do, obviously, we have sanitizers everywhere. We wipe down and spray down things between every patient. Our tables are separated by a wall. We try to stagger people as they come in. I wear a mask, when I'm adjusting patients. We recommend people wearing it, but some people don't have it. That's fine. But at least we try to encourage that. So we do everything we can to keep it as clean as possible. And probably now it's probably the cleanest, most people's offices and homes have ever been, right? I think everybody's just stepping up the sanitary, washing their hands more than ever. So we do everything we can, but I don't really work with people's bodily fluids. So it is still extremely safe. And then we have the face paper that we changes between every patient. So I think everybody's just stepped up their game. And if somebody is really, really in that vulnerable age, the elderly or whatever, or they have an autoimmune disease or diabetes or anything else like that, we sometimes see them after hours when there's nobody else in there. So I come in before hours and after hours. So I try to accommodate everybody. Some people don't care, and some people are very afraid. So we try to I'll make some house calls for some people, and some people I see after hours when it's just me and them in there. So we do what we can.
Let's talk. And your like office was designed for that, because it was the three areas where you do it are all separated, and you always change anyway. So it's always been clean. Go into a little bit about the weight loss. I tried all sorts of things before, I came to Denise. And I got one day I was at, I hit a 200 number I wasn't proud of and struggling, and she really helped. I lost, 30 pounds, and I'm right now about 3-4 pounds off of it. So I'm really happy with it. But it was the most simple, easy to understand, a little communist, and then I could, here's your choices. But you actually had a wide variety, but it's so easy that you don't have to really think of all sorts of outsides type of stuff. So can you explain what it is and why it's safe and why it works?
Well, the ideal protein is a very simplistic way of getting highly assimilated protein into your body. So it's basically a kind of a form of keto diet where you're cutting out most of your carbohydrates. Carbohydrates is what's going to turn into sugar, which turns into fat if you don't use it. And if you eat carbs, your body will store the fat, and you're never going to lose the fat. So it's basically prepackaged food like bars, drinks, soups, and you have 3 of those snacks or meals a day, along with a regular meal of vegetables and a protein of your choice. So it's very simple. And if it's not simple and convenient, people are not going to stick to it.
So like for me, like I would do, there's shakes that you could get, and I put them right in the refrigerator, and I take a little shake. That's my breakfast, and I'm full. And, I have a lot of water, throughout the day. And then you have different varieties of things. You could use another shake, but you'll have things that could be almost like a trail mix thing, or you could make spaghetti, but a lot of things you can go on your own, like different bars, like chocolate bars or strawberry chocolate bars. There's potato chips. So you pick 2 of those, and then at night you get 6 ounces of protein and, and some steamed vegetables, and it's good. And you don't have to think about what am I going to do? So it's a really easy program where it's not overly complicated, and you're measuring that. And for me, I would lose 3.5 pounds to 4 pounds a week on that particular program, and then be able to, to keep it off using it. But it also taught me how to eat, like different things to avoid, like, when I was on there, carrots, because that has a lot of sugar, in it. So you kind of learned from Denise what to use and what not to use. And besides that, I think, as we're seeing here, that it puts you, there's all sorts of risks that people have, and when you're overweight, and a lot of people just, that's just how their bodies work as well. It puts you at other types of risks for other things. So it's much safer, and you feel you have more energy when you're, or more at a manageable, weight. Besides feeling a little bit good about yourself too.
Yeah. Besides looking good in a Speedo. Yeah, no, I'm just kidding. But
we don't want that.
Yeah. It is, and especially in this day and age, with the COVID-19, it's not a question of, if you're going to be, coming in contact with the virus, it's when, because you can't hide from it forever. So, the better shape you are, with your weight and blood pressure and everything else, and diabetes, the better chance you have surviving anything. So it's been we've actually seen an uptick in people wanting to do it now, because they realize that if your BMI is too high, you're at a greatest risk group for dying from this virus. So it's been pretty cool to see people finally starting, taking their health to heart, so to speak. I
saw Denise, though, before the keto thing. Everybody was really talking about it a few years ago, but she's wonderful, and you come in, you're accountable. So, you come in and you do a weight, and it's in a private room. So, she can be she's your weight shrink, and you can open up, for all that. And in all seriousness, you talk about it, but it's such a simple thing. It helps you get into the rhythm, I think, of weight loss. It's one of the best things that I ever did. And I tried a lot of different things, and it was frustrating, I think, like everybody, does who has an issue with it.
Yeah, I think the only tough thing for people is, like, they have to quit drinking, because obviously alcohol is a big thing for people, that they do it socially, and some people do it because they feel like they need it. But if people can just stay away from the booze for a while, that's the toughest thing. But it's a simple thing. She will hold you accountable. She will beat you up if you don't follow her recommendations. That's a good thing. I married her. Trust me, I know. So yeah, she's a tough one, but at least, because you got to have somebody that can kind of lay down the hammer, so to speak, and tell you what to do, and keep you motivated. And because you weigh in every week with her. So that's a good thing too. And then
No, it's
she teaches you also how to eat properly after you're done with it, so that you don't go back to your old bad habits, because that's the key. You want to lose it and keep it off. You don't want to just go back and forth like a yo-yo diet. You want to get the weight off and then go back on a healthy lifestyle and eat the right way for the rest of your life.
No, that's what it is. It's healthy, and it helps you with that immediate thing, but then you get on a pattern and you can substitute stuff in there, and then you just get in the rhythm of what you're doing with your eating, but you're understanding food better. Yep. So, like the only thing I did, and, I went on, afterwards when I was done with it, we as a family decided to do a pescatarian diet and take meat out. One of the reasons I did it, even though there's some healthy meats out there, but I think I found that, like, when I was eating meat, I would order French fries with it or other things that were not as healthy. So it put me it eliminated some things that I didn't want to do. But when what was I going to say? When I did that with it, it's easy to work. It works hand in hand. The only thing that you made me do is I went to Sweden and Stockholm, and Christian gave me the name of this restaurant there, and I'm looking at a Swedish meatball in the face. So I had a decision to make, a moral dilemma. And I did have the Swedish meatball. I had a meatball and a half, and it was so good. So that's the only time I've cheated, and it's your fault.
Yeah, but it was in my hometown, so it was worth it, man. It was great.
Yeah, it's a wonderful country. If you've never been to Sweden, and Stockholm is just an awesome, happy.
The old town, yes.
Yeah. What was the name of the restaurant that we went to?
Oh my goodness. That's a good question. I think, what's it called? I actually, the next year when I went there, me and Denise went there too for our anniversary, and I had the meatballs too.
Yeah, it was really good. It was really good stuff. So
yeah, I'm
like, I was not going to eat it, and I'm like, I don't know when I'm going to be back here. So yeah. How can I go to Stockholm and not have a Swedish meatball?
Yeah, that would have been a sin. Yeah,
it would have been a sin. It was delicious.
Yeah.
So, hey, Rob, what's your question with your back? What's the back problem going on?
So I've always had terrible posture. I slouch. I'm editing, so I'm in its chair sometimes. I'm like this, editing. And I've tried correcting myself. I try to keep myself as straight up as I can anymore when I'm sitting.
It's a mess.
But I still slouch. But one of my problems, Dr. Christian, is I was a videographer for 10 years in the news. And we had the cameras, you've seen them, video cameras that sit on the shoulders. And my one shoulder, if I can remember how I held my camera.
You're like the humpback from Notre Dame.
One shoulder is not even. My wife always says, your one shoulder goes down more.
Yeah.
I mean, of course, I guess I'd have to come in to see you to get it adjusted. But what's some tips for people, including myself, that maybe are sitting for hours on end out of the day, either on their computer or doing things? What's some tips just to get up and move around, stretch? Give me some tips.
Yeah, I got a bunch of them. Well, number one thing, about every 30 to 45 minutes, set a timer so you can get up and move around a little bit. That's the number one thing. Because, even if you stand for a long time, that gets annoying too. Or, so you want to get up and down a little bit every so often. You go to the bathroom, go and get some water. That's the number one thing. Number two, make sure that you have an ergonomically correct workstation. So you want to make sure that your chair has a good lumbar support, that you have some arm rests to your chair that can adjust to the length of your arms. So it's not pushing you up or your arms are just hanging there. Sometimes people also have one of those chairs that like just one of those big balls that you can sit on. That makes you have a little better posture. So you have better arch in your lower back. So I always tell patients, like, the workstation's got to be good. Also, some people start using a stand-up desk. So you can have that very desk, you can move it up and down. That's really good. So a lot of attorneys that I have in my office and people that sit a lot there, or accountants, they now have a stand-up desk, and then they can lower it down so they can sit for a while too. So I like the stand-up desks, which has been really helpful, and the work productivity goes up and people are just more energetic. So those are the things that I like to do that you can just do mechanically. The other thing is, obviously, once in a while, make sure you get up and stretch. Everybody gets tight in their chest. So I tell them to get into the doorway or into the corner of a wall, in a room, and really stretch out, and push your head back, and I always tell people too, when they're in their car, if they're sitting a lot, is to make sure that the seat isn't leaning back too far, because then the head is going to shoot forward. So I tell them to have their seat a little more straight out. And then also once in a while, just do some head retraction exercises where they push their head back into the headrest to make sure that your head is almost touching it. Because the number one common or the number one abnormal posture is that forward head syndrome, where, you know, your head is like, you know, 5 feet in front of your body. And then that puts a lot of that tension onto your neck, and that can lead to headaches and neck tension, you know, numbness and tingling down your arms and everything else. And it can cause that also lack of oxygen to your body, because you're just basically crouching down and compressing your lungs and everything. So posture is a big thing for your overall health. And so just once in a while, just get up, stretch and move around. That's really the key there.
One thing I learned too is my youngest son, it's so weird. I swear he would get an ear infection every couple months. He'd have an ear infection, another ear infection, another infection. And we took him to get checked out. This was a few years ago. And a chiropractor told me that can really help getting you know, yourself readjusted and realigned can help get rid of those earaches, those ear infections. And it actually, after he started going, he didn't get it. He didn't have an ear infection. So it was incredible so I guess people don't realize the benefits of chiropractics in an overall health.
That's a great point there, because it is not that the chiropractor is the one that's curing the patient per se, because you have the innate intelligence, your inborn, your body wants to heal, you know. So if we can remove the interference, whether it's in your upper cervical spine or anywhere else in your spine, if we can remove that interference and let the body start healing better, you have a greater chance of healing up from any disease or any condition, whether it's a migraine or ear infection or irritable bowel syndrome. I don't care what it is. Our job is not to cure that. It's to improve the structure and the function of the spine, let the body start healing better and function better. So yeah, that's how that kind of works. Yeah.
So bring it back to its natural, it's let the body heal itself in essence, right?
Yep. That's the goal. And of course you do that through, you know, proper rest, good mental attitude, proper nutrition, exercise, and what we call the nervous system through chiropractic. Yeah.
So one other question I have, and it's actually a question from Facebook. Holly's watching.
All right.
And
Hi, Holly.
she wants to know, I don't know if you guys discussed yet about scoliosis. Tell us a little bit about I've heard of scoliosis. What is it and how do you treat that?
All right. So scoliosis, actually the picture behind to your left of your head, that's a picture from the side view. Now from the side view, the spine is supposed to have those three curves. You want to have a forward curve in your neck, backwards in the mid back, and a forward in your lower back. Now the spine is supposed to be crooked from the side, but from the front view, if somebody's looking straight at me, the spine is supposed to be perfectly straight. So when the spine curves from the front view, kind of like that poster up there on the left, that's called a scoliosis, meaning that it curves to the side when it's supposed to be straight. So in our office, we do specific, mirror image exercise and traction to try to improve that. And the key is to find it as early as possible, of course, before the skeleton is fully matured and ossified. And of course, we recommend sometimes a brace, where people wear a brace, which is a dynamic brace with 4 bungee cords and everything else that kind of holds them in an opposite position of what the spine looks like. So hopefully with time, it can start to straighten out a little bit, because our goal is always to try to avoid people from having to go to surgery for that and put metal rods and things like that in the spine. So scoliosis is basically a curvature of the spine when it's supposed to be straight.
Okay. Rob, any other questions?
I don't think so. Just interesting stuff here with Dr. Christian. And you're located again, Dr. Christian. You're located in Jupiter off of Indiantown Road. Tell people where you're located.
Yep, it's 1102 West Indiantown Road, Suite 11, but it's basically behind Water's Edge Dermatology. It used to be the Quarter Deck. It's in the same shopping center as Jupiter Fitness Center. So it's in the back corner there in the individual professional plazas, and it's the shops of Jupiter Creek.
And what's and the website is spinedesignchiro.com. So you can check it out there, spinedesignchiro, CHIRO.com. And what's the phone number for people, the best office number for people to reach if they want to come get checked out or they have questions?
Yeah, it's 561-741-1316. So 741-1316.
So another local business, Jeff, another local business owner who lives in our community and gives back to the community. wealth of knowledge, a person that, you know, if you're have some back pain, shoulder pains, neck pains, just overall questions. He's an expert. He's here to help. How's your back, Jeff? Your back's all right?
It's not as good as it could be, but I think over time doing the exercises and in there, it's been helped me get through this whole thing better than it would have been if I didn't. And, you know, managing, you know, weight loss in here too, and, you know, being in good, you know, position for this. I think you're correct. We're going to run into, you know, if we all get this at some point, the better shape that we're in getting it, because that we can control is going to end up helping, you know, with this.
And Dr. Christian, you also treat a lot of athletes, I take it, right? A lot of golfers and all that different type of athletes.
So, you know, we see anything from, you know, auto accidents to sporting injuries to people that just want to improve their spine and health and wellness and regular migraines, headaches, neck pain, you know, the basic stuff. But yeah, I have seen a lot of professional golfers over the years, especially in this area, you know. So a lot of the guys that you see on tour have been patients in my office or are currently patients in my office. So it's been very helpful for people in the golfing community as well. I see a lot of the people members from the local clubs around here. So
You see a lot with golf. I assume hockey as well.
Yep, we do have some hockey players too. You know, I'm coaching my kids right now, hockey. So I see a lot of the younger kids as well. But some of the retired NHL guys that live down here, we see them too. And some football players and baseball players over the years. So I've seen you know, I don't really care, you know, what brings you in my office. A spine is a spine. It's if it needs help, it needs help. So it's been great.
You know, the last thing is I can just tell you with Dr. Christian and Denise and everybody there, they're really out to, you know, they're in it for the right reason. They like people and they like helping people, and they educate you, and they're most importantly, they're really good at what they do. They listen, they diagnose, and they know, and then they execute. They know how to treat it. Very hard to find that. It's an A+, you know, referral. Anytime I've ever given your name out, it's a major thank you for that.
I really,
so we, you know, you're, you know, we're local. You're an important part of our community, and you know, glad you help everybody that you do.
Well, thank you for what you guys do. Thanks for having me on here today. I really appreciate it.
Not a problem. Thanks for joining us, Dr. Christian, and giving us a little more insight into, you know, keeping in better shape. That helps out a lot, and having the correct posture.
And Rob, you've got a lot of stuff to do.
I need to work on my posture. My posture is not good. But you know, again, another local business in our community, that's Spine Design, right off of Indiantown Road in Jupiter. And we will be back at 3 o'clock today with a Try Bike and Run local bike shop located in Juno Beach, and Chris Burke will be joining us for that one. And I'm sure they've been busy. It seems like everybody's been out biking that haven't biked in years, because there's not many cars on the road, and you're able to enjoy different places and going around this beautiful area on a bike. So she's going to talk about how busy they've been there at Try Bike and Run. Linda's the owner over there.
I love that store.
You've been there too? So yeah, I mean,
you better believe it.
They've been busy. I'm sure a lot of people dusted off the bikes and needed new chains and tires, and they sell bikes there. So we're going to talk with her at 3 o'clock with Chris Burke. So join us back at 3 o'clock, Dr. Christian from Spine Design. Thank you again for joining us. And Jeff, as always,
Adios.
Have a great afternoon.
Thank you.
Okay.
Bye.
So long.